CPT 90,000 Medicine Series Part 5. Here we are going to cover the hydration and then the remaining topic. So let's begin. So here we are basically going to understand the difference between injection, infusion, hydration and chemotherapy in detail, and we are going to see the guidelines related to that. So the CPT manual divides the drug administration service into three different categories. One is hydration, where the codes are 96360 and 96361. Then we are going to see the therapeutic, prophylactic and diagnostic injection and infusion. And then the third is the chemotherapy and other highly complex drugs or highly complex biological agent administration. And in the bracket, I have given the code range for every category. Now, whenever we are looking at the hydration chapter, one must understand the hierarchy. And what is hierarchy? That chemotherapy infusion is at the top, followed by chemotherapy intravenous push and chemotherapy injection. Then comes the therapeutic prophylactic diagnostic infusion, followed by IV push and followed by therapeutic injection, and the last come hydration. So if you look at this particular pyramid very carefully, you will see that infusion is at the top, followed by IV push and then the hydration. So this is very, very important hierarchy. Now let us understand few more terminology related to this topic. One is the initial service. The term initial service refers to the procedure or the treatment that best represent the main purpose of the patient visit or encounter. So if the patient has come, suppose if the patient has a lot of loose motion and because of that he is dehydrated and he comes to the hospital and he has been given hydration, that is the initial service. Okay, because that is the main purpose and that is the treatment that has been given. Now let us understand the sequential administration. Sequential administration occurs when two or more different medications are infused one after another using the same IV line. Each drug must be distinct from another. So this is a drug 1. Once that is over, then the drug 2 starts. They are in the sequence. While the concurrent administration refers to the simultaneous infusion of multiple therapeutic or the diagnostic medication through the separate bags but using the same IV access. So this is a bag 1 and bag 2. Both the medications are given at the same time through the same IV access. Here it is one after another. Here it is at the same time. So this is very, very important terminologies. Now, in order to determine which service should be written first service when there is more than one type of service, hierarchy has been created. The initial code should be selected using the hierarchy, whereby the chemotherapy services are primary to therapeutic prophylactic and diagnostic services which are primary to hydration. Infusions are primary to pushes and which are primary to injection. So, for example, if the patient comes and you start the service with a hydration and then you give a infusion to the patient. So let's say the patient comes at 9 a.m. You start with hydration and at 10 a.m. you gave the infusion. So you gave the infusion later, but when it comes to coding, you will write the infusion first because infusion is at the top of the pyramid and hydration is at the bottom. So you will always use this hierarchy whenever you are coding. It doesn't matter that the hydration was given first. What matters is how to follow that hierarchy while coding. Now let us understand what is infusion. Infusion, it is basically the administration of a drug normally performed slowly over the set period of a time 16 minutes or longer. It delivers a medication or a fluid over a period of time typically intravenously. Okay, and we have the initial and each additional R code. So the code range is this. So what you have understood is infusion is nothing but when the drug is given intravenously and usually the time period is more than 16 minutes. Now these are the code for the infusion, and this is the primary code while these are the add-on code. So the primary code is for the intravenous infusion for the initial 1 hour. This is the add-on code. This is for each additional hour. Now there are two add-on code, so we must look into the detail of the 96366. So this is the code. It is for report 96366 in conjunction with 96365 to identify each second and subsequent infusion of the same drug. So this is for the same drug. While 96361 is an additional sequential infusion of a new drug substance up to 1 hour. Okay, so this is for the same substance, this is for the new substance. And then there is one more add-on code, and this add-on code is for the concurrent infusion. And in the bracket they have given list separately in addition to the primary code and report 96368 only once per date of service. Okay, so you know now the difference infusion code. Now let us take one example for you to understand it very clearly. So drug A infusion is given 9 a.m. to 11 a.m. and drug B infusion given 11 a.m. to 12 p.m. So now first, how will you code drug A infusion? It is given for how many hours? 2 hours. So the first hour I will code it 96365 and second hour I'll code it 96366. Why I'm coding that way? Because it becomes the same substance and for the each additional hour. Okay, so I'm going to code it. Now the drug B, which starts at 11 a.m. and completes at 12 p.m. For this drug, I will have to code 96367. Because if you remember from the previous slide, we use this code whenever the new drug is given. And here drug B is given, which is a new drug, and that's why we will write it like this. So pay attention to this thing. Now let us understand what do you mean by IV push. One-time quick administration into the bloodstream via current IV access device already in the place. It is single or initial substance or drug. A type of infusion lasting 15 minutes or less. So if it is more than 16 minutes, we call it as an infusion, but if it is lesser than 16 minutes, we call it as a IV push. Multiple IV pushes of the same drug must have minimum of 30 minutes between each. This is very important, note. And these are the code for the IV pushes. Now let us deep dive into IV push CPT code. So the first code is 96374. It is an intravenous push, single or initial drug. Then this is each additional sequential intravenous push of a new substance or a drug. And this is the each additional sequential intravenous push of the same substance. So pay attention, this is the same and this is a new. List separately in addition to the code for the primary procedure. Okay, so one must read the code language very carefully. Now let us try and understand this example. Here we have given the IV push of the three drugs. One is diclofenac, which is given at 10:30, then atropine, which is given at 10:45, and then the third time diclofenac, which is given at 10:55. So we will find out what is the code. So in this first example, we will write for the first diclofenac, we will write the code 96374 because it is a single or initial substance. And for the atropine, we are going to write each additional sequential intravenous push because after this is given. Now for the third diclofenac, we will not write the code. Now why we don't write the code? Because there is a guideline that there has to be the difference of half an hour between the two same drugs. So we cannot write. But take another example. Here what we have done is we have given the third diclofenac, but I have tried to change the timings here. So instead of 10:55, we have given 11:05. Now, these are the two same drugs. And what is the timing? It is more than 30 minutes. So here, for this example, I am going to write 96376 because the time exceeds 30 minutes. So I hope you understand the difference between the two examples, and where we have taken the help of all the guidelines, and this is how you will be able to understand the guidelines well. Now let us come to the injections. The administration of the medicine directly into the body through the needle or a syringe. All of the medication is delivered to a body system immediately. It can be administered intradermally, intramuscularly, intravenously, intraarterial and subcutaneous route. And we have the code 96372. Not required to check the end time. And same drug, if you are administrating, there has to be a minimum gap of 30 minutes for you to code it. Now last is a hydration. What is hydration? Hydration is a solution which may include the combination of the sugar, carbohydrates, electrolyte and trace elements delivered by the infusion hanging back with a fluid, sodium chloride or potassium chloride, used to report specific therapeutic intravenous volume loss or the dehydration. And we have the two code. One is 96360 and then there is a add-on code 96361. Necessity should be documented in the record. So this is as per as the hydration. Let us deep dive into the hydration code, and in that you will have the primary code which is 96360. It is for the intravenous hydration initial 31 minutes to 1 hour. That is very important. And do not report 96360 if performed as a concurrent infusion service. And do not report the intravenous infusion for the hydration of 30 minutes or less. So if the hydration is given for less than 30 minutes, we do not code it. Then let us come to the add-on code. This is for each additional hour. And this code we will write it in addition to the code for the primary procedure. Now this 96361 for the hydration, it is for the interval of greater than 30 minutes beyond 1 hour. So 96361 need extra 31 minutes to add that code. Okay, remember that. And so basically this is the add-on code, and to write that code we will have to have minimum 31 minutes. Now report 96361 to identify the hydration if provided as a secondary or subsequent service after the different initial service is administered through the same IV access. So if you have a primary service or the initial service and then you have given the hydration, that time you will write the add-on code. That is very, very important. Now let us try and understand the hydration coding. A patient receives the sodium chloride hydration from 11 a.m. to 2 p.m. That means how many hours? That means minimum 3 hours. 11 to 12, 12 to 1, 1 to 2. So how will I code it? So in that case, I will code 96360 for the first hour and 96361 for the 2 hours. Now in this case, you will write it like this. Now the patient receives the sodium chloride from 9 a.m. to 9:20 a.m. and what will you code? So in that case, there won't be any code because this is less than 30 minutes. And in order to write the hydration code, we have to have minimum 31 minutes. And then now the next is patient receives the sodium chloride from 11 a.m. to 12:30 a.m. 12:30 p.m. So that means it is 1.5 hour. So how will you code it? So you will code it 96360 because I cannot write an additional unit of 96361 because it is only 30 minutes. We have to have more than 30 minutes. Okay, so this is the only code that we will write here. Let us come to the chemotherapy. Chemotherapy administration codes are 96401 to 549. Applied to the parenteral administration of the non-radionuclide antineoplastic drug and also the antineoplastic agent. And this is a very helpful chart which will help you to code it correctly, see the minutes, and the same chart I gave you for the hydration also, that will help you to understand how to code them correctly. So the therapeutic, prophylactic, and diagnostic, the injections are given in the form of infusion, IV push, hydration, and injection. And if you take a close look at it, you will see that every code, every section has one primary code and three add-on code. So we should not assign two primary code for a patient on the same date of service and the same access. Instead, use one primary code based upon the hierarchy and then the add-on code for all others. You can code two primary code only when two different access sites are used. So this is a very important tips for you to code correctly. So if there is an infusion and hydration that has been given, for the infusion I will use the primary code, but for the hydration it will be always the add-on code. So that is very important. Now, use of the modified 59. When documentation support two separate IV site, append a modifier 59. This is very important. Modifier 59 is only allowed if applied to separate anatomical location within the same encounter. And we always use the modifier 59 on the code which is lesser in the hierarchy or which is lower in the hierarchy. So let us take one example. A 45-year-old male patient present to the ED with dehydration and fever. As per the physician order, the resident nurse administered the following. She administered dextrose from 9:10 to 10:20. Then she administered citriaxone from 10:25 to 11:20. That becomes 55 minutes. Ketorolac 11:25 to 11:40, 15 minutes, and Phenargan 11:45 to 12, 15 minutes. Now we will have to take into consideration the hierarchy. What comes the first? Therapeutic infusion. We are trying to give the therapy. So for which we are going to use the primary code. This is the primary code. Now, for the remaining for the remaining IV pushes, which comes second in the hierarchy, we are going to use the add-on code because one primary and then the remaining add-on if it is the same site. So we are going to use the add-on code for the first IV push. Now for the second IV push, also we are going to use the same add-on code because it is the new drug, because these two drugs are new, different drugs, not a new, more than new, it is a different drug. So for which also we are going to use 96375. And then comes last the hydration, for which also we are going to use the add-on code. So what will be my final answer? 96365 primary code because it is an infusion, then IV push, that is second, and I will use two add-on code for the two different type of drugs, and then the hydration for which also I will use the add-on code. So let's take one more example. A 72-year-old patient arrives with a severe headache and vomiting after minor head trauma. As per physician order, the resident nurse administered the following. She gave her diluted, which is a hydromorphone, and it is given at 8 a.m. It is in the form of IV push. Then second diluted was given at 8:20. Then she was given the Reglan, which was given at 8:22, and another Reglan was given at 9 a.m. And the magnesium sulfate infusion was given 9:10 to 9:30. So let us find out what is the answer. Now here all are IV pushes, okay? But if you see these two drugs, they are the same. Now, whenever you are giving the two drugs by the IV push, the time difference between the two should be more than 30 minutes. So I will code for the first IV push, but I may not code for this. Then this is the drug B. This is a drug A, this is a drug B. Here it started at 8:22, for which I will code it 96375. And here I'm coding it because what is the difference between this two drug? It is more than 30 minutes. So I will code 96376 also. So here you look at this table and then you understand that for the first it is a primary code and the rest I am giving the add-on code. And this is the hydration, magnesium sulfate hydration, for which we will not code it because the time duration is less than 30 minutes. So my final answer will be 96374, 375 and 376. A 63-year-old male patient present to ED with severe migraine and dizziness. As per the physician order, the iron administered the following. The hydromorphone IV push 8:15 a.m., metoclopramide 10 mg IV push 8:25 p.m. a.m., lactate trigger solution 8:30 a.m. to 11:40 a.m., and magnesium sulfate IV infusion 9:45 a.m. to 10:45 a.m. administered via a separate IV access site. Now here we are going to see how to give the coding. So first of all, what is important? Infusion is always at the top. So we are going to write a primary code for this, and in the hierarchy it is at the top, so that will be my first code. Now the second code also will be a primary code. Usually when if the drugs are given from the same axis, the rule is one primary code and remaining add-on code. But here the axes are different. So for this I am using the primary code. Even for this also I am using the primary code. Remember that. This is slightly different. So I'm going to use the primary code for this. Now the second drug is 96375 because this is the second drug, and for that which we will use add-on code. I will write a modifier 59 on the IV push, not on the infusion, because in the hierarchy IV push is the second level. So you always write 59 on the second, and then for the hydration also I'll be writing the add-on code. So these three drugs are given from same access site, and this is at the separate access site. So for the hydration also I'll be writing 96361 into 3. So I hope all these three examples has cleared all your doubts about the guidelines, and it will help you to solve all the questions. Now we will take all the questions that has come into the CPC exam. Now let us take the example. Sally suffered from dehydration after running a marathon. She was taken into her primary care doctor's office. Dr. Small checked Sally and ordered hydration therapy with a normal saline. The hydration lasted 45 minutes. How would you report this service? Now go through all the codes, understand the what is being given hydration, and the time is 45 minutes, and tell me the answer. And yes, C is the correct answer because it is a 45 minutes, and for 96360 we count 31 minutes to 1 hour. So 45 minutes is only we will give it with by the code 96360. Now the next question is, the cancer patient is coming in to have a chemotherapy infusion. The physician notes that the patient is dehydrated and will first administer the hydration infusion. The infusion time was 1 hour 30 minutes. Select the code that should be reported for the encounter. So you have the code, just go through all the codes and tell me the answer. So yes, 96360 is the correct answer because what is the time? 1 hour 30 minutes. Now out of that, the first 30 minutes are we do not anyway count. So what is remaining is 1 hour, and for that we will use the code 96360. Now a patient present for the pleural cavity chemotherapy session that require arthrocentesis to be performed. So what is the answer? Now you have all this code. If you look at the first code, it is 446 and 440. So first find out which is the correct code. Chemotherapy administration into the pleural cavity requiring and including thoracentesis And here it is a chemotherapy administration into the peritoneal cavity via implanted port or catheter. So 96440 is the correct code. We will definitely require that code. Now let us look at what is this 32555. It is the thoracocentesis needle or catheter aspiration of the pleural space without imaging and with imaging. Now this is the code for the with imaging, but in our patient case the imaging is not mentioned. So you tell me what is your answer. So yes, 96440 is the correct answer. Now if in the same question, if they would have mentioned that the doctor took the help of image guidance, then B would have been correct answer. Now, the second topic is a moderate conscious sedation. Moderate sedation is a drug-induced depression of a consciousness during which the patient is relaxed, responsive to verbal command, and maintained an independent airway and cardiovascular function. It may be reported separately when medically necessary and properly documented. Now, if you look at the code range is 99151 to 99157. Now, whenever we are coding the moderate sedation, there are three important markers that we consider. One is who provides the sedation. Is the same doctor versus the different provider? That means there is additional doctor who is present. What is the age of the patient? That is whether it is above 5 years or below 5 years, and the intra-service time. That is the active sedation time only. So these are the three parameters which will help us to zero down the code. Now let us look at this particular codes, and you will see that all the codes depends on the three important points. Who has given the moderate sedation, what is the age of the patient, and what is the time. So here it is the same provider, and these are for the different provider. And above 5 years, less than 5 years, any age. Initial 15 minutes, and this is a add-on code. So same is true for the different provider also. So whenever you are looking for the moderate sedation question, only three parameters are important. Now next is the acupuncture. Acupuncture coding line, they are the time-based reporting. It is acupuncture is reported in 15 minutes increment of a personal contact time with a patient. It does not include the duration of the needle placement. Only one initial code may be reported per day. So what are the code? The codes are like this, and the codes divided whether you have the without electrical stimulation and with electrical stimulation. So pay attention to that. And if the ENM service office visit consultation may, if it is done, it may be reported in addition to the acupuncture, and for which we will use the modifier 25. Now the next important topic is the osteopathic manipulative treatment, which is called as the OMT. The CPT code range is in this category, and they are used for hands-on approach used by the physician to diagnose and treat the somatic dysfunction across different body regions. And if you provide a separately identifiable ENM service on the same day, then that service may be reported by using the modifier 25. OMT code, they have the various body regions, and depending upon the body region and the code language, we decide the code. So if you look at the code for the OMT, these are like this, and OMT 1 or 2 body region, 3 and 4, 5 and 6. And for the CPT has defined the 10 body region for OMT, and these are the various regions. So pay attention to that, in which area it has happened, how many regions they are covering, and depending upon that, the code varies. Next comes the chiropractic manipulative treatment, which is called as a CMT. The code range is 98940 to 98943. And if the separately identifiable ENM service is given, then may be billed in addition to the CMT code by putting the modified 25. Now let us come to the code. The code range is more or less similar, but you will understand that chiropractic is mainly related to the spinal area. And you will see that the code language is pretty much same. We also calculate the region 1 or 2, 3 or 4 or the 5 region. So pay attention what treatment has been given in which region and how many areas are included. So if you look at this, the OMT, it treats the somatic dysfunction in any body region, though it is a head, spine, pelvis, ribs, limbs, and viscera, while the CMT is specifically for the spinal subluxation and extraspinal joints. So that's the only basic difference between a CMT and OMT. So let us take one question. A patient is coming in to have a osteopathic manipulative treatment performed on two roots lesion in his cervical region and the three root lesion in the thoracic region. Which code is reported by the physician for the OMT? Now, the lesion may be one or two, but what is important is the region. So let us understand what are the thing is the cervical region and then the thoracic region. So ideally we have checked two region. In one region they must have corrected two lesion. But what is important is the region. Body region refers to as a head region, cervical region, thoracic region, lumbar region, sacral region, pelvic region. So I have already shown you the different region that we check into OM. So yes, 98925, that is the option C is the correct answer. There is no need to multiply it by 5 because the code language specifies the region. And I told you that we calculate the region, not the lesions. So, irrespective of how many lesions we have treated, what decides the code is the region. And this is my last slide, and we have pretty much covered the CPT medicine. In case if you have any question or the query, you can ask in the the message in the message section, and I will answer to it. So thank you very much, and then we will see the remaining topics. That is HECPEX, and then we'll start with ICT.